Have you seen something on Google, or has your dentist suggested your child needs to be treated with a myofunctional appliance? Have they said they can get better growth and avoid braces by using them? Then you don't want to miss out on today's topic as I explore the evidence regarding myofunctional appliances. Hi, I'm Peter Miles, an orthodontist, and I aim to give you the straight talk about orthodontics. Myofunctional therapy, or sometimes called orofacial myology, is treatment aimed at changing the oral environment and ridding a patient of oral habits that may be contributing to a malocclusion or bad tooth alignment and bite. One stream of myofunctional therapy aims to treat very early in life, say 5 years of age, and claim it encourages better jaw growth and tooth alignment and may even avoid braces later in life. Now this sounds fantastic, but is it effective and does it hold up long term? So let's look at the research using myofunctional appliances such as the eruption guidance appliance and the MyoBrace in young children. Now in these studies, treatment ranged from 13 to 36 months, and over this time, the protrusion of the top teeth reduced by an average 1.5 to 2.5 millimeters, which is considered a small change by an orthodontist. We're commonly dealing with 7 millimeters or more protrusion. Now, one of the best studies in the European Journal of Orthodontics found unsuccessful treatment in 70% of the children using the myofunctional appliances. Another study in the American Journal of Orthodontics found that much of this small change in the bite and alignment relapsed virtually back to where it started, and so it's unlikely to have prevented later treatment. Myofunctional appliances and therapy have been around for over 100 years in orthodontics, so it's not new. Now, some will state that, in my experience it works, or I don't see that in my hands. But a clinical trial is the best test as to what your child could expect from treatment, and that's what these studies were. An orthodontist is a registered specialist dentist who has spent usually a further 3 years and over 5,000 hours of full-time training on correcting bites and on growth and development. For these reasons, orthodontists will choose the most effective treatment option for your child's problems, and also the most appropriate age for treatment. Early treatment can be indicated for protrusive teeth to reduce the risk of trauma or when the appearance or function is concerning your child. So if you're unsure about whether early treatment is required for your child, consult an expert, your local orthodontist. Now please feel free to share this with friends and relatives with young children or ask questions. Thanks for tuning in. I'm Peter Miles, and I'll see you next time for more straight talk about orthodontics.